ALS and Myasthenia Gravis Neuromuscular Disorders Final Project. Group 3, Diana Donahoe, Maria Bauer, Christina Calderon, Kendall Hudson, Richard Osei, Sherry Perk, Brianna Wilbur, Jordan Sparks, and Bethany Emer. Risk factors for ALS. While unclear, there are current studies to uncover a little bit more about this topic. These studies include echovirus RNA, damage from free radicals, higher than normal glutamate levels, links to other autoimmune disorders, excess intracellular calcium, antibodies to calcium channels, and then the impact of age, diet, and military service. Risk factors for myasthenia gravis include thyrotoxicosis, rheumatoid arthritis, and lupus erythematosus. Clinical manifestations for ALS include dysfunction of upper motor neurons resulting in spastic weak muscles and deep tendon reflexes, dysfunction of lower motor neurons resulting in muscle flaccidity, paresis, paralysis, and atrophy. Early manifestations include muscle twitches in extremities and twitching of involved muscles. Progressive manifestations of ALS include patient complaints of progressive fatigue, and this occurs as muscle mass decreases. Manifestations from brainstem involvement include dysphagia, dysarthria, emotional lability, loss of control. Additionally, as the disease progresses, you'll lose the ability to stand, walk, use your hands or arms, and you will require ventilation support. Clinical manifestations of myasthenia gravis include manifestations that are corresponding to the muscles that are involved. If the ocular and facial muscles are involved, you'll have unilateral or bilateral double vision, drooping of eyelids, dysarthria, and eye muscles that are affected initially. Nutritionally, you'll have symptoms of dysphagia and difficulty chewing. Musculoskeletal weakness and fatigue, decreased functioning of extremities and neck muscles, such as head jutting forward, and often the voice will become weak, muffled, and have a nasal quality. Deep tendon reflexes remain normal even if the muscle is weakened. Fine motor functioning decreases, and from a respiratory perspective, you can have weakening of intercostal muscles, poor gas exchange, breathlessness, and dyspnea. Complications from ALS can include choking. This is because over time, the muscles used for swallowing become ineffective and can cause one to choke on secretions or mucosa. Pneumonia. This is due to the inability to swallow. Patients are more likely at risk for getting food, liquids, or saliva into the lungs, where they aspirate and cause pneumonia. Malnutrition. Dysphagia prevents them from eating orally, so tube feedings must be utilized to prevent malnutrition. And bed sores. Paralysis prevents the patient from being able to move, which puts the patient at greater risk. Complications for myasthenia gravis is the myasthenic crisis, which is a sudden exacerbation of motor weakness resulting in risk for aspiration and respiratory failure. This is often due to missed medications or under medication. Signs and symptoms of these are tachycardia, tachypnea, dysphagia, restlessness, and impaired speech. Additionally, a complication could be a cholinergic crisis. This is a result of overdoses of your cholinergic medications. Signs and symptoms include severe muscle weakness, vertigo, respiratory distress. It is important to note that both of these crises are emergent situations. Holistic and collaborative care for ALS. The primary goal here is to support the patient and family in meeting physical and psychological needs. Care should be focused on current health problems, anticipating future difficulties, and decreasing complications related to the loss of muscular function and immobility. You will want to refer patients to social work for home health management, financial assistance, and dietary needs. Additionally, the referral to occupational, physical, speech, and respiratory therapy are major supportive rehabilitative treatments. Initial reactions to ALS may include anger and depression, so patients and their families should be encouraged to seek counseling or attend support groups. Teach families how to suction and perform the Heimlich maneuver to prevent aspiration and how to prevent problems with immobility like repositioning and turning to avoid bed sores. Holistic collaborative care for myasthenia gravis. Care focuses here on preventing the crisis we mentioned on the previous slide and providing psychological support to patients and their families. Patients and families should be taught to schedule periods of rest, avoid stress, avoid cigarette smoking, and taking the medications exactly as prescribed. Also, you will want to help them understand that they need to avoid extreme temperatures and to avoid other people with upper respiratory infections. Patients who have impaired swallowing should be referred to a speech therapist, and their families should be taught the Heimlich maneuver and how to suction. Patients and families should be referred to support groups, taught prevention and recognition of crisis situations, and to provide helpful resources, and we will discuss that on the next slide. There can be a profound psychosocial impact on those that are diagnosed with ALS and myasthenia gravis, as well as their families. For ALS, anticipatory grieving, depression, anger, and emotional lability are common. Support groups can provide emotional support as the patient and family deal with the likely reality of an eventual death. For myasthenia gravis, low self-esteem and interrupted family process or caregiver role strain due to loss of or impaired ability to carry out necessary or routine activities by oneself. Provide information about support groups that can provide encouragement and assistance to patients and their families. Community resources are vast for each of these neuromuscular disorders. For ALS, there's the DREAM Foundation, ALS Support Network, the ALS Association, which has newsletters, books, and family support and help. There are therapy groups, community blogs, and various support groups available. Myasthenia gravis, community resources include the Myasthenia Gravis Foundation of America, the Myasthenia Gravis Hope Foundation, the National Organization of Rare Diseases. There are therapy groups, community blogs, and support groups for this disorder as well. Concept maps for ALS are reflective of the holistic care needed to take care of these patients. From a cognition perspective, there will be impaired judgment, changes in behavior, an inability to concentrate, impaired memory, and speech changes. In functional ability, there's an inability to carry out ADLs, dysphagia, weakness in upper and lower extremities. Holistically, from a nutrition perspective, there's a risk of aspiration, there's trouble chewing, and dysphagia will eventually lead to a need for a PEG tube for adequate nutritional intake. From a sensory perceptual standpoint, sensory neurons are not affected, but lower and upper motor neurons are destroyed. Oxygen and ventilation. There will be a gradual loss of respiratory function that will eventually require non-invasive mechanical ventilation, trach, and/or invasive ventilation. Perfusion, blood flow parallels the disease severity in the brain. Concept map for myasthenia gravis. Cognition should not be affected by this disease process. For functional ability, there will be a weakness in hands, fingers, legs, and neck. Nutritionally, a patient can experience fatigue while chewing. Also, they can experience dysphagia, esophageal muscle weakness. Sensory perceptual standpoint, paralysis is descending, so think mind to ground. Starts with the eyes and facial weakness and can lead to dysarthria. Oxygenation, there's a poor gas exchange, ineffective airway clearance, and that's related to the respiratory muscles weakening. From a perfusion standpoint, respiratory muscle weakness can lead to respiratory failure and contribute to poor perfusion.